Almost half of the prison population at the Alice Springs Correctional Centre has tested positive to COVID-19. That's about 300 inmates, most of whom are Aboriginal, and experience higher rates of chronic illness.
We have to remember that people cannot safely isolate or have access to appropriate care in a situation where, when there's 8 to 10 people in a particular cell, or entire blocks in prisons are being infected.
It sparked an urgent call from the legal services and advocacy groups for the early or temporary release of prisoners to manage the growing outbreak.
When we're actually providing advice and pleading with governments to please release those who are low risk and who could actually be living within community settings and in a much safer environment, of course, our calls and our asks keep falling on deaf ears.
We have people who are being placed in isolation or COVID red, as some of them are classified, and they don't have access to a lawyer and they don't have access to their first appearance in court for some period of time.
According to recent NT government figures, 86% of eligible prisoners have received 2 doses of a COVID vaccine. The NT Health Minister Natasha Files says the situation at the prison is under control.
It's very mild illness, in fact, in a large number of cases, no symptoms at all. The situation is well in hand.
The outbreak at the Alice Springs prison is just one of many concerns of Aboriginal organisations who say they're facing an unfolding crisis, with several remote communities battling COVID outbreaks and cut off by flooding during the wet season. There are currently 6,576 active cases in the Northern Territory, which represents close to 3% of the population. Lock-ins for the remote Aboriginal communities Umbladawatch, Largamanu and its surrounding homelands, Palumpa, Milikapiti, Milingimbi, Elcho and Wessel Islands remain in place. During a lock-in, residents can move freely within the area, but are not able to leave unless it's for an authorised reason. These are some of the poorest communities in the nation. Houses are overcrowded and social distancing is impossible. Aboriginal groups are increasingly frustrated that it's proving as difficult to stop the spread here as it is in prisons. Saskia Mabin, ABC News, Alice Springs.